Hello, everyone, and welcome to another episode of DEO Growth Secrets. I'm your fearless host, Emmett Scott, and today I'm excited because we actually have one of our very own DEO members who's been scaling tremendously with us and has developed out a product that I think everyone's going to be interested in. So, welcome, Dr. Khan, or as I know him as a good friend, Vajahat. Just so good to have you on. And usually I don't like to do like a long bio, but you've got an interesting story because you're a dentist entrepreneur. You've done very well building out your practices in Texas, board certified pediatric dentist, former assistant professor at UT Houston. And now you're solving tech problems. And I'm just curious, for our listeners to hear a little bit of the story. How'd you go from clinician slash professor to entrepreneur? And then what got you in, to this tech side?
Hello, everybody. Good morning. It's great to be with Emmet. I never thought I'll be on this side of the table and, he will be interviewing me, but this is an exciting thing. I'm very excited about that. Yeah, so story, it has two aspects to it. Like everybody else, I came to this country in 2003 with a dream
Yeah.
of making it big or, having a great life for my family. So very family-oriented person. So started on a mission, studied here, went to do two residencies. One was at UMKC and the other one at LSU. So after I finished my residency, I immediately took up a position of a associate professor at UT. While doing that, I decided, professorship is great, but it doesn't pay you as well. So I decided to go on and venture into private practice. And I started my first practice in 2010. Immediately realized that there were a lot of difficulties in running a business. Um, Went on to start my second and third, and then realized that it's really, really difficult to scale. So I had a brother who moved back to India because of health reasons. And when he went back, I decided that, let me just start a venture over there with him because he knew the operations of the dental office. And that made me think about having an offshore service.
Mm.
And I had tried out some other services and it had already made my business profitable. But I wanted to do more. And what I realized was, having your own setup would make a big difference in the bottom line. So I created that. And then immediately from 3 practices, I was able to scale up to 11 practices in a span of 4 years.
Yeah.
So
Wow.
I could see the potential, I could see the growth. But then all my friends that were around me, and we had like a real clear dialogue with each other. They saw the growth and they were like, okay, can you help us out building our own setups? So I was like, okay, let's work on that. So I got 5 clients like that and I set up a team for them. And then it just started expanding to a point. Now we have 110 clients and we have 350 people in India. So to
Wow.
manage that big of a team started becoming an issue because you can only do so much with spreadsheets, right? So I started building on the idea of, okay, well, how can we make it more streamlined to where we are able to ascertain the metrics of the people that are working with us, make sure that they're performing to their full potential, help them out so that they have ease in managing what operations and what roles they are fulfilling in this whole mission. So we started building the software, and one led to the other, and then we created a monster. I call it a monster because it has so many things in it, and we just I'm not able to like have a demo of an hour and can explain everything to a person who's listening to my demo because it's
Sure.
become so big. So it's a great product, and we were able to design it in a way where I felt as a clinician that there were gaps in the industry as far as the tech was concerned. Everything was scattered. You have had to subscribe to like 5 different solutions, and be disconnected with each other. There were a lot of things that were different in each one of them. There were a lot of things that were overlapping. So that led us to create an ecosystem of sorts where we could bring everything on one platform and then help our users to be able to keep their stuff, which means a lot to them, at one place and be able to increase their profitability. So that creation is what I call a monster, basically. So I'm passionate about it. I mean, what happens is whenever I'm doing these practice consulting sessions with my colleagues, I find out that, everybody else that is involved in the business of dentistry is making money a lot of times, but the dentist doesn't take as much home that they are supposed to take. And
Mhm.
the primary reason for that is, they're so disconnected. They are not involved in the business operation. So I always tell people, it's very important that if you're a clinician, don't let anybody tell you, don't let that cliche attack you that, you are a clinician, do what you do best, take care of the patient, don't worry about the money, don't worry about the business aspect, let us take care of that for you. I always tell people that do not fall for that cliche. Always go back, look at your sheets, make sure that you're reading everything that you have done at the end of the day. That is what business is. So if you have spent 8 hours of your time working on 5 difficult cases, spend 15 minutes, spend half an hour on looking at your day sheet, on looking at what you have done through the day. And all of that, what we did in DentTracks is we brought all of that together so that the business owner, the clinician, the office manager, even at the agent level, everybody can see their performances and figure out what they have done for the day.
Well, let's break this down because I love the story and I want to take it down to like I'm a single dentist in a practice and I'm thinking through my day to day, and one of the things we really coach on is number one, understand your P&L, your profit and loss statement. But number two, typically the lowest hanging fruit is somewhere in the collections process, right? Because those are patients that have already come in the door. Those are people you've already treated, et cetera. And I think a lot of work you've done is around making that collections process more streamlined. So let's kind of take your monster, DentTracks here. Let's take it kind of step by step and talk through the problem and then the solution that you provided. Because what it sounds like is you're using a nice combo of both tech and outsourced labor in order to reduce overall labor costs within the practice and to streamline systems and processes. I know a lot of what I hear from dentists out there is it's hard to find good people. It's hard to keep systems. Maybe they just don't have systems. As you said, there's obviously focus first has to be on taking care of the patients. So some of these front desk items, RCM, i.e., collections items, are not their expertise. And so they find themselves kind of spinning their wheels here and not collecting as much as they think they should. So, can we kind of break down maybe one part at a time? And let's imagine I'm a typical dentist. I know that one of the things is when a patient comes in, their insurance has to be verified, right?
Yeah.
Unless I'm fee for service, right? Everybody else, it's got to be verified. So is that something that you solve? Like kind of take me step by step through the process.
Yes, you hit the right point. So the whole RCM process begins with insurance verification, right? So how many practices are there that only do fee for service? Very few.
Yeah.
So majority of them are actually contracted with PPOs, Medicaid, and the biggest issue with them is collections, obviously, because the insurance is in the business of not paying, and that's how they make their money. And what we do is we try to make sure that they pay every single penny that they owe you. So it begins with eligibility verification. So we've solved that problem to a great extent with the use of direct integrations that we have with the PMSs as well as the clearinghouses. And we have incorporated AI in it, whether you call it the agentic AI or you call it the document processing AI. So what happens is when your patient is on your books, say DentTracks. The patient is on the schedule. Our system runs automatically based on whatever the user decides. 48 hours before the appointment of the patient, I want my eligibility verification. So there is no need to hit a button. There is no need to do anything. It'll, as
It's
soon
an
as the
auto
patient
read.
gets,
Yeah.
yeah, it'll do an auto processing for your eligibility verification. So we call that as a basic eligibility verification. You know how clearinghouses are. They are going to provide you with information that's available out there through their insurances. And a lot of times those insurance details are not enough. MetLife will give you a very detailed breakdown. Cigna will give you an okay big breakdown. Delta Dental may not give you a very good breakdown. So
There's no standardization. There's no regulatory requirement, right? So whatever they give you, they give you. And if
right.
you need more than that, you're going to have to call in.
Right. So what we have done is we have incorporated a second layer in it,
Mm.
which is document processing AI. So we have our, so basically our systems will call the insurance, and then the insurance will send a fax. And then our systems will pick up a fax, and it'll read through the fax in an intelligent way. And we have like a pre-formed 3-page document, which is very structured for every office, and it can be customized based on the type of the office. And all that information is automatically filled into that form. And that form becomes the holy grail, and nobody can touch it. Like so for example, if there are fields in the form that are not filled and the agent still has to call, then what we do is we lock those fields. So the agent cannot make alterations in any field if it's already locked. Now, if the
So what you're
offender,
saying there is like, if I decide these are the things I need to know,
yeah,
then I need to know them, right? So I want it to be the form because if I'm doing a little more ortho or I'm doing a little more implant or I'm doing, whatever my bread and butter might be, I need to have that insurance verification. I don't need some generic version. And so what you're saying is this becomes like a color by number, where, hey, I've decided this is what I need to do. You're using tech, you're using fax AI readers, you're using everything. And then at the end of the day, you're using a manual process where someone's going to call and make sure everything is filled out. I'm going to get a complete, as much as possible, I'm going to
right.
get a complete verification, right?
Right. So we call it like basic, advanced, and comprehensive. So for
Mm.
comprehensive, we do involve our agents. So if somebody needs a comprehensive, we do involve the agents, and they will prepare all those for you. And then we have the capability in our systems to be able to go back into the insurance tables of the PMSs and change whatever we need to change in the PMS tables. Plus, we have the capability of pushing all these eligibility verifications in the form of PDF documents into the charts of the patients. And all of this is done in an automated way. The agent is not involved in all of this. It's all streamlined with the tech. So that saves a lot of time. And then we are working towards,
And I just freed up my front desk person, right? I mean, like that is
yeah,
a lot of time on the phone that somebody that I'm paying dollars for, that they are in office. There's a lot of things in office that are required that I could leverage them for, but instead they're stuck on the phone or trying to get this. And then having that consistency means I know what procedures are covered by how much. So everything downstream. That's why I think anyone who's an expert in RCM always starts with verification because it makes everything downstream so much better, right?
absolutely. I mean,
Yeah.
if you put garbage in, you will get garbage out. It is a trickle down effect where if the eligibility is not correct, then your biller will have an issue, then they will waste their time, and then
Right. Totally.
everybody will be frustrated. So it's better to do it in a way where the front end is your perfectly done, you have proper data, and then everything following becomes easier. You're right.
Well, and then the patient portion's a little closer too, right? Which means all my follow-up for that now I can, really get a closer number before they walk out the door. But I think it's good to call out like the amount of labor dollars that ends up chasing, $10 here and there because we just
Yes.
don't have clarity up front. So
Right. So
that's awesome.
once
Yeah.
the eligibility is done, for example, we are walking through the steps, right? So you see the patient, you post what the charges are, and then your biller sends the claim. So we are integrated with Wine Dental as well as Change Healthcare, two of them, to be able to send out claims, get claim statusing on a real-time basis. So what happens most of the times is once you send the claim out, and if there is a bottleneck, whether the bottleneck is at the clearinghouse level or the insurance level or your PMS level, the claim gets kicked back into the system. And most of the managers, they don't go back and run the reports to figure out that, the claim is still stuck. It has not gone out. So we capture all of those incidences in our next module, and which is called then sent. And we capture all of them and we bring it in front of the manager and we bring it in front of the business owner. For example, if on the 1st of March you had 10 patients seen that had insurances, all the claims have gone out, but 2 claims are stuck in the clearinghouse. We bring it over and over in front of the manager. We send notifications to the manager. We send notifications to the owner that this claim hasn't gone out, so that action can be taken on them. And then you prevent a lot of issues related to the timely filing limits, especially with Medicaid, and you're able to send the claims out at the right time. So this real-time claim statusing that we are providing for our platform is something new in the industry. And it's something that is really helping the profitability of the practice and preventing the loss of revenue and bleeding.
These are real dollars that are just sitting there, right? And
Yeah.
it's strictly the lack of systems that exist within PMS and their ability to integrate well with clearinghouses, et cetera, that you're really bridging the gap on,
Right.
which means real-time communication with the patient, real-time fixing. By the way, how hard is it too when you're like, oh, doctor, I need this info, and it's 3 months later and the doctor's trying to remember X, Y, and Z versus like the next day or later that day or things like that. I mean, there's again just so much efficiency that happens.
Right. And to touch on that point, say for example, on 1st of March, you had a patient that had an elaborate procedure, 10 line items, and your manager sent a claim out. And out of those 10 line items in 15 days, you got a payment for 5 line items, and then 5 are not paid. And there is a note in the EOB that says that they need more information. They need x-rays, they need a narrative, or they need a perio chart or something, right? And then the manager looks at that and enters all that information in the new claim and then sends it over again. Like 15 days after, you get the claim paid again, and then out of those 5, 3 are paid and 2 are still not paid. And and you have to go back and you have to again read everything and then figure out what happened. So what we do with our platform, which is the next one, after you send the claim out, we have the next platform, DentTracks, in which we preserve the whole life cycle of the claim. So what it means is that every version of the claim is preserved in there, from the point of the first submission of the claim to the point of getting the balance on the account zero. We preserve the whole life cycle of the claim in one place. So all the attempts that have been done to collect this money is entered into that particular claim in the notes section, where you're able to see everything in one place. So it makes it very easy for the whole RCM team and the managers, whether it's an offshore team or it's the in-house team in the office, to view it in a way where it becomes very easy for them. So anybody who's working on the claim, if biller number 1 worked on the claim for the first time, biller number 2 worked on the second time, and 3 worked on the third time, they're all able to see what happened with the claim, and it's easy for them to just turn around and send it back. And a lot of this thing, say for example, reading of the EOBs and then putting the notes in and stuff. Right now, our agents do it. But like I told you, we are working hard on document processing AI.
Yeah.
We have a plan of putting all of that in an intelligent way through the use of AI, and we don't have to use agents for this anymore, hopefully in the future. So all of this data will be preserved in one place, and it becomes easy for managing the AR. And then
So
everybody,
much easier. So
yeah,
much easier.
yeah, yeah. So everybody who's working on it, let's say the agent is working on it, they're not supposed to send the claims out, but when they're working on it, they're able to change the statuses We have like bunch of statuses in there, which we have come over the years with the input from all the other clients that we have from our own practices. So when somebody sees that demo, they are like, oh yeah, this is what I needed. This is what I needed. And that way, it's satisfying a lot of people because it's so detailed.
I know this wasn't the purpose of why you built this, but the other thing it would give me comfort around on just like even single practice is theft. Because one of the problems that, a lot of our dentists will have is because they don't really understand the RCM process, because the reports aren't clear, because the process itself isn't transparent. I could see that this starts to help me understand. Here I am as a clinician doing my day to day. If I can see these reports, if I can see this patterns, things like big adjustments, big write offs, things that are usually used for theft, frankly, become much more clear and transparent. And frankly, having it outsourced as well also decreases the chance of theft. Since most theft, most issues with technology actually have happen in the practice, not on outsourced solutions. And so
Uh,
I love it for that too. We were just in doing an on-site review for one of our members, just joined, and one of our fractional COO coaches went out there, and they were producing on a fee level, on a contract level, 200,000 a month, but they were only seeing about 150 come in. And I thought for sure it was theft. We'll see. But from what we did on the initial, it actually was just bad processes, and just people overwhelmed. And I don't actually know what to do. You're saying it here, Vajahat, like they will know how to take care of it. Sometimes they don't, it's not as easy as like just send some more x-rays. And if they don't have that really bundled up where they can go to somebody else or talk it through, I think that's
Yeah,
a
so
big
what we
issue.
have done, Emmet, on another module, it's called Dent Accounts, is that we have solved this problem too. So what we have done, we have integration on one side with the PMS, and we have created integrations with about 250 banks on this side. So whatever is posted in the PMS versus what is getting collected in the bank, which is the
Mm,
actual number, we are showing it on a dashboard completely reconciled. So for
reconcile it. Yeah.
example, on a particular week, say first week of March, you want to look at what was collected in the PMS. Say it's $50,000, and in your bank, if it is showing $55,000, what does it tell you? It tells you that okay, your bank has received $5,000 extra, which is not posted in the PMS. If it's
Gotcha.
the reverse way, you are seeing $60,000 in the PMS and you're only seeing $55,000 in the bank, what does it tell you? It tells you that, there is over posting here. Something wrong is going on, right? Maybe
Mhm.
there's some credit card issue. So we have broken it down. So this tool is an awesome tool where we have broken it down into different types of payments that an office receives. You can drill it down. Even the batch payments that come in, you can break it down by the patients. You can break it down by different methods of payment, whether it's care credit or credit card, or it's a patient check or even cash. We have created a cash management system within this tool, which is where the major theft happens,
Yeah.
right? Because if you have 15 offices and you have like different people dealing with cash, it becomes really overwhelming for the business owner. So we've created a process around this particular technology. So we are calling it best practices for handling the cash.
Mm.
And this process will help an office just completely eliminate embezzlement as far as cash is concerned. I mean,
Wow.
other things of embezzlement that you mentioned earlier, they can be easily defined and easily caught with the regular process of dent accounts that we have built. But
Yeah.
cash was a big challenge for us too. So we have
Yeah.
created a process and we've created the technology around it. So that will pretty much resolve the issues, even related to cash for most of these offices. And
Wow.
it's an awesome tool.
Yeah. Yeah, it's amazing. Because again, when we set off to open a dental practice, this was not on our radar. Okay, let's just be
Yes.
honest. Like, this was not the part we were thinking about. Is like, man, I'm going to need to become an expert on how to bill insurance companies, how to post this. I need to know that the practice management software actually doesn't handle this really well, and I need to have a totally separate solution for this and a team just to handle this one side, not on our radar. So that's what I love about our innovation partners here at DEO is like you guys are making investments and solving things, and then you just bolt those in and boom, it's taken care of. So yeah, this is awesome. What have you noticed now having this? Obviously, you built this first for yourself,
Yeah.
and then you made the mistake of helping your friends out. And then it just grows into more and more and more. But what have you noticed as a difference? And what have you noticed for some of your clients or friends who start using this? What's the big, what's the big
So,
return that I see in, let's say, 90 days?
yeah, so the biggest return is the profitability, right? I
Mhm.
mean, it's
You
very
literally
simple.
collect more money. Yeah.
Absolutely. You collect more money and you don't have to increase your team members to the capacity that you're collecting that money. What I mean by
Mhm.
that is, okay, say you have improved your profitability, say, example, a number, $20,000. Now, to be able to manage those $20,000, sometimes when you are at a stage of 3 to 4 practices, you are in a kind of a bind where okay, you need to hire 2 more people or 3 more people. But if you
Yeah.
hire those 2, 3 people, then that profitability is wiped out by almost like 70%, right?
Yeah.
So what we do, which sets us apart, is okay, we improve that profitability, but yeah, your expense will go up maybe by 3,000, 4,000, $5,000, but you get to keep that $20,000 in your pocket. So
Yeah.
that is the biggest plus that you
Well,
will.
and I don't have to get them the technology, meaning like if I hire someone in house, here's the only negative, especially at these inflection points. Where am I going to put them? So now am I getting another space? Am I putting them in a practice? How do those practices talk to each other? All of that I have to solve for. I have to get them the computer, the tech, all of those things. And it's just more humans I'm directly managing. So I think you're solving at multiple levels here where I can have the people in the four walls of the practice be the people taking care of the patients, which I think in today's world, by the way, it's getting more and more competitive too, that if something can be done virtually, people want to work virtually.
Right,
So now what am I going to do? Hire people from home to do this? I would rather have a platform and a software in place to.
right. I mean, some of our clients are even looking into the concept of not having a heavy admin staff at all. Like, they will basically have only the staff that touches the patient. That
Yeah.
means hygienists, dental assistants, and doctors. And they are training them. They are supposed to be dual trained now so that they can handle everything along with the tech within the office confines. And you don't need to have people who are actually helping the clients at the front end. I mean, with for example, what we have built with our DentCom module, which is powered by AI solution. It's a complete platform where everything gets captured into one place. Like
Mm.
if you're marketing at different places like Google ads, you have Instagram ads, Facebook ads, you have microsites, you have your own website, you have some teams that are going and doing outreach and stuff. So we are collecting all of this into one funnel. And when the call comes through, our voice AI agent answers the call. When the voice AI agent is able to book a patient appointment, that's great. If it's not able to, or if the patient wants to speak to a live agent, then only the call gets transferred to a live agent. And
Mm.
then they talk the stuff out, right? But what we are doing, which is different from other voice AI agents that are out there, is we are training our models to go ahead and do outgoing calls. So I'll tell you a real case study that we did. So when we were training our model to do outgoing calls, I saw that in the month of January, in the last week, I had a practice where we had a really scanty schedule. And we had a big recall calling list. The people in the office were not getting time to call all these patients.
Yeah.
And there was a big unscheduled treatment list. So we went ahead and we trained that model to fill in only those 3 days of that week. And at once, the voice agent was able to call 500 patients.
Wow.
Okay. And then within 2 hours,
Phones were
the
ringing
slots were
across
filled.
Texas here. Yeah.
Yeah. In 2 hours, those slots were filled because there are
Wow.
patients who are actually wanting to make an appointment, right? So if
Right.
you have 500 people in a list and you
Yeah.
have like 15 slots that are empty, it just made calls. As long as those slots were empty, it just kept making calls, and then it filled the spots.
Wow. I mean, think about the number of humans to make 500 calls in that
Absolutely,
period of time, right?
absolutely.
Yeah, that's just
And then think about the concept, if this voice model that I'm training can call for unscheduled treatments,
yeah, yeah,
like actual unscheduled treatments, and it's able to read the EOBs, and it's able to read the eligibility verification and the breakdowns. Can you see where this is going?
totally.
And
Yeah,
absolutely killer, right? So
yeah.
I'm really excited about that. We are working very closely with our really smart set of engineers. At the end of the day, see what comes down to the real world is the subject matter expertise. And
Mm.
that's why my experience and my background comes into play. I'm working extra hard on all these things to be able to, train the models the way I want them to function and the way I want my colleagues to have the experience with them. So it's going in the right direction, and we are very, very, very excited about this.
Well, and I love that you're a user, right? Because you're building it for yourself, which is actually what all of us need as well. Something that practically works, that understands the human components, understands the patient components, understands the profitability, not just like a cool idea sitting on a heel here, but something that's going to actually drive a net return for everyone. I love it. And yeah, and when you come back to if I don't have to have as many people in the practice doing some of these outbound tasks and so forth, honestly, it means I can pay the people in the practice more dollars, right? I mean, and that's where it starts getting very competitive. I need the hygienist, I need that dental assistant, I need the individuals who are going to be touching the patient, and I need to find ways to be more efficient, especially on scale, especially multiple locations. But even on an individual practice level, either I can keep those dollars, I can share those dollars, but ultimately it will make me much more competitive. And if I'm collecting more dollars, I mean, it's just a domino effect here of profitability, which is so important at DEO. So,
Yeah, you touched on that point about how it made a difference for me when I outsourced.
yeah,
So I had two phases where I was sourcing to another company, and then I started my own, right?
yeah.
So when I was outsourcing to another company, it was still profitable. It was awesome, like, so it was in the range of like 70%, I would say. So I was saving 30% more when I was
Uh-huh.
outsourcing. But when I started my own, that number went to 20%. So I was
Mm,
saving 80%. So,
mm.
so that's why I tell people, and our model is like that too. Like at USA Dental Solutions, we are able to create offshore delivery centers for people. I mean, they're not supposed to be in our control, but we build it for them. There are differences in those setups that we do for our clients. The biggest difference is the size and the preference. So we cannot do this kind of a setup of offshore delivery center for a client who's doing 5 millions, for example. But if it is a client that's doing 15 million or more, then it becomes easier for us to set it
You
up
can do a
themselves.
custom solution for those
Exactly,
people. Yeah,
exactly.
yeah.
So, and
Gotcha.
then we do it on a consulting basis and some kind of a profit sharing model. But all these personnel that we build for them and the facility that we build for them is for their own sake. It's their own. They can have their own company in India, for example, and they can be utilizing that resource for as much as they want to scale.
Yeah, got it.
Yeah.
Awesome. So everywhere from single doctor up to custom enterprise solution, you guys are solving it because you understand the model. Um,
Yeah. Well,
if
a lot of it
somebody,
is a learning from DEO. I mean, I've been a part of DEO for the last 7, 8 years, and last time when I attended the meeting, I was interviewed for that. So I'm sure that interview is going to come out. I
yeah,
have a lot
yeah,
of good things to say about DEO, but at the same time, I mean, the best thing I like about DEO is the sharing part. All of us are there to share all these ideas and to get ideas, and then to I mean, having a plan is one thing, but to share it with your colleagues and see that, it can be materialized is something that gives you direction and guidance. And I've gotten that a lot from DEO, and I'm really grateful for that.
Well, congratulations on your success. It is cool being with, I now we're over 350 entrepreneur organizations at DEO, what, 2.7 billion in revenue between all of you. And many of them individual doctors just adding their, second doctor to a location, all the way up to obviously some mega groups. But yeah, to crowdsource this entrepreneurship is amazing. A couple questions I think people are going to be wondering. Number one is, I wonder if this integrates with my practice management software. Are there kind of like a big five that you would say that you
Yeah.
guys integrate
So
with?
yeah, so we are integrated with Dentrix, EagleSoft, Open Dental. We are in the process of integrating with Denticon, Dentrix
Cool.
Ascend, and there's one more that's called some 32. I'm forgetting its name.
Oh yeah, tab 32. Yeah.
Yeah, Tab 32.
Yeah.
So we just got into conversations with them. So yeah,
Okay, great.
big five are there already.
Yeah, for sure. Even more, it
Yeah.
sounds like. And then if I wanted to reach out to you and just have you do a little assessment and say, is this really right for me? What's the best way for someone to contact you? And like, yes, please help me with my RCM. I'm
Yeah.
not collecting what I need to be, and it feels like a mess. So,
Yeah. So
or maybe
I've
I'm an office manager who's like, I'm tired of trying to manage this. I need somebody to oversee on this, and I want to take this to my, dentist owner. So
Yeah, I mean, so all those models exist, and people can contact me on my LinkedIn, and I've provided the websites and social media pages on the links here. Um, but you're right about that. Like, there is B2B business for us too, right? So there are lots of consultants, RCM consultants. There are consultants for practice management. So they contact us because they want to
mm,
have proper tech for their clients, or they want to have proper techs to manage their own team. Some of them have like teams of hundreds of people, and they contact us because they don't want people, but they want the tech. So all those possibilities exist. So people can contact me on my LinkedIn, and absolutely will be glad to do an assessment. By the way, for DEO members, we have a special, and you can talk about that in your talks. We are going to be at the show in Phoenix, and
awesome.
we are excited to launch at the show. So we have not gotten out and went on to give this licenses to any of our other members outside of our own managed services that we are providing through USA Dental Solutions. So this will be the first time at DEO event that we will be taking clients. So we are
That's awesome.
launching in Phoenix, and I'll be there with my team members, and then we'll have detailed conversations over there. We'll bring in some demos, and we'll be able to show the real case scenarios to people so that they can feel confident about what we've built.
Awesome. Yeah, if you want to be a part of that conference, it is now exclusive to only our members and their teams. But you can go over to deodentalgroup.com and sign up for an accelerator call, meet with one of our team members, and they can kind of talk through if it's the right fit for you. So yeah, it's been absolutely fabulous having you in the group, Doc, and just what you're creating here, I think is amazing for the industry. The reality is there are so many problems to solve as an
Yeah.
entrepreneur,
Yeah.
and to have other entrepreneurs who are like, hey, I'll take this one. Hey, you take that one, And for some, just being able to like, I just need to be able to show up and do the clinical and have everything else, done for me. This is super helpful. So I really appreciate this. Anything else you want to say in closing here? I mean, this has been amazing. I think a lot of people are feeling maybe a little relief, like, good, I'm glad someone's solving this and they can reach
Well,
out.
maybe overwhelmed, because I get overwhelmed. Like I
Yeah.
said, this is a monster, and it's very difficult to explain in one sitting what we have created. But what I've seen in tech industry is a lot of people are trying to now collaborate and create an ecosystem. So
Mhm.
so this is a new trend that's going on in the tech industry, to collaborate and create an ecosystem for an industry. So this was not by design, but we are at the forefront of this concept now. That we have created an ecosystem right from the beginning. So would be glad to showcase it and have any questions answered if people have questions about that. Look us up on our website, denttracks.com or usadentalsolutions.com. And then we have social media pages, and my LinkedIn is already shared. So yeah, we'll be glad to help out. And we have a special right now where we do practice analysis for people.
Awesome.
It's a cost of about $7,000, but we are doing it for free for DEO members.
It's awesome.
So complete practice analysis where the bottlenecks are, and we will give you a detailed report on that, where we are able to show you, where the opportunities are, and then where you would require, if you require any type of help. But if you don't, then we tell you a truth answer that, okay, you don't need anything. You're working or functioning perfectly fine.
It's like an X-ray machine for your gold mine. Like you can
Yeah.
just look and see where the gold is sitting and
Yeah.
then decide if you want to go dig it out or not. So that's amazing. Hey, thank you so much, Doc. Thanks for everything again that you contribute to DEO and to the industry here. Again, for those who want to get that analysis, reach out to Dr. Khan here. And until next time, keep smiling.